Hello, my name is Priyanka
And this is Shamili.
from Let's Update Language Academy.
Yeah.
And without further introduction, yes, we are here to present a card. And this time it's actually, I'll be playing the role of the nurse and Shamli will be playing the role of
patient or interlocutor.
yes, and I'll introduce a scenario to them. My patient is 50-year-old at the outpatient clinic for a hernia repair, and I see the patient to carry out pre-operative checks. So, reading out this scenario, we were actually discussing about the commonly asked cards,
Yeah.
right?
Yes.
So, this pre-operative checks or post-operative arrangements, these are something that is commonly asked during the examination. And which were those cards which usually comes in examination?
Yeah, usually it comes like a discharge cards or a wound care, something like that.
Yes, definitely. So these are the common cards that I often see in the examination. So you can check out the role play cards that we have presented, and you can understand some common things that usually comes in such cards. Okay. So as I always mention to you, whenever you practice or study, you have to make a structure out of it. So you can group certain cards like this and find some common questions that is often asked. So practice accordingly rather than blindly performing certain task every day and doing another one. So it doesn't gives you an improvement. But find out this common points that is usually seen in the cards and prepare accordingly. So you feel very relaxed during the examination. So shall we start the class?
Yeah, sure.
Okay, so as I said, I'm the nurse, so I'll be starting right now. Good morning, Shamli.
Good morning.
My name is Priyanka and I'm one of the registered nurses in this outpatient clinic.
Okay.
So I understand that you had a hernia repair surgery and that is you are scheduled for a hernia repair surgery, and I'm here to prepare you before that. So I have some pre-operative checks to be undergone. So are you prepared for that?
Yeah, sure. Almost.
Okay, that's good. So I would like to know, are you practicing the instructions that I have given to you, like no food for another 6 hours and also no fluids for another 2 hours. So are you, have you already started with that?
Oh yeah, I followed all your instruction, but now I feel very thirsty.
Oh, I totally understand that you are feeling thirsty because you have been nil by mouth. But why we have instructed this is because during the surgery, you will be giving anesthesia. So if you take inside any food or fluids, there is a chance of vomiting or you feel nauseous. So that's the reason that we have requested you to be nil by mouth. Okay?
Yeah,
I hope it is understandable.
Yeah, it's clear.
All right. So, do you have any recent illness?
No, I don't have any recent illness.
Okay, so can I move forward with the clinical observations?
Yeah, but I want to talk to you something regarding my surgery.
Okay.
Can I take my watch inside so I can check the time?
All right, that's actually a very reasonable question from your side. I appreciate for asking me that question. You know, during the surgery, there are certain, again, observation steps that you need to follow. First of all, we'll be giving you a hospital gown to wear and a compression stockings, and you are supposed to also wear a non-slip slippers. But as you've asked, you have requested me to take the watch inside, right? But I'm so sorry, there is no valuables or jewelry allowed inside. You know why? Because we need to seal the blood vessel, and for that we use electric current. So there is a risk of burns if you take in the jewelry items. I hope that's pretty clear to you.
Oh yeah, that's clear.
Yeah, I do understand your concern, but this is not allowed. I'm so sorry for that.
Okay.
So as a next step, a doctor will come and check you, and he'll be collecting the personal and the medical details, and you may have to sign a consent. Will that be okay for you?
Yeah, that's okay. And my sister will come for before the surgery, but what time I should say? I'm just confused regarding the time.
Yeah, I can feel your concern because you really wanted to be with your family soon after the surgery, but I'm so sorry. Right now I cannot give you an exact time that when you will be going home, because during the discharge or before the discharge, there are certain requirements that we need to check after the surgery. For example, your vital signs will be checked to find out whether it is stable, and we'll be checking whether you are ready to take in the food and fluid, and only after passing the urine we can confirm that you are stable and healthy enough to go home. Okay, so these are the certain things that we need to check.
Yeah.
After that, definitely you can join your home and you feel very comfortable.
Yeah.
How does that sound?
Yeah, that sounds good, and I felt more confidence. Like before going to the surgery, I feel more confidence to do this.
I'm so happy to hear that. So can I start the clinical
Oh,
observation?
yeah, sure.
Alright, thank you so much for the cooperation, Shamli. So we'll perform that.
Thank you.
So that was the card. Again, what I would like to make into your notice is that my candidate or my interlocutor was giving me the questions before what I really want to ask. This can happen in the original examination as well. So you were expecting your interlocutor to ask the question after a certain point, but what happened is the interlocutor may ask it before answering. So how do you handle the situation? You should be good enough to handle the situation. You can say that I appreciate that you have asked that question. I was about to tell you regarding that. So these are the phrases that you can use in such situation, and you may practice in certain way and you will get different scenario, different personalities in front of you. But do not panic, be confident, and you should be able to use your language flexibly and spontaneously. So keep practicing the exam cards. Definitely you can attain a good score. Thank you so much.
Thank you. Bye.